Hi, good evening. My name is Chris Thornley. I'm the chairman of the Monroe Board of Health. Calling to order the meeting, regular meeting on December the 10th of 2025. This meeting will be conducted solely remotely via electronic equipment and pursuant of all the Connecticut statutes and public acts. Um, the first order of business on our agenda for this evening um, will be, seeing as though there is no public participation, will be the acceptance of the minutes from our last meeting, which is dated September the 10th of 2025. I've read the minutes and I do agree with them, so I will motion to accept said minutes.
I can second that motion.
Excellent. Mike?
I accept as well.
Okay, great. Thank you. Motion carries unanimous, and the minutes are accepted. Now turn the meeting over to Laurel for the Director of Public Health's report, so she can start talking about some of the revenue issues, and then we can move right into the budget and all that sort of thing.
Okay. All right. Hello, everybody. Um, I'll just run through these quickly. The environmental activity or statistics you could see in that report, and everything is pretty much the same as it has been. It's a little bit slower with the septic for the holiday seasons. We expect that. You know, housing market kind of impacts inspections, so we have less going on, but we're still doing some here and there. Um, the salons are in relicensure right now, so those inspections will increase because we're going to be doing them throughout December. Licensing, it ends December 31st. So hopefully we have all of them in and no issues there. And then as for the revenue report, think we are, well, the food licensing is a little bit lower these months because our annual licensing isn't till March, so it will increase then. No new places have come in as of right now. Um, and again, salons will be picking up because we're doing relicensing now. Child vaccines, we've done 75 so far to date. So, and that is continuing. We are doing a lot more than we normally are, which is great. And
Any reason why it's up, do you think?
I think just the availability and people
Hmm.
without insurance, they're
Yeah,
looking for
probably.
other avenues to get those vaccines for school.
Yeah.
Flu vaccines, measles, hepatitis, DPD, all of them, which is great that they come to us for that, because we can offer it for a low cost, if not free. So other than that, I don't know if anyone has any questions about either of those two documents, but they should be pretty, self-explanatory. And then other items from November, just wanted to mention that we had the annual commissioners meeting, which was pretty basic. She just gave us a quick greeting and just talked about some local health items. We have the Radon partnership with DPH coming up. We had that meeting this month, so we'll roll that out in January and hopefully giving out some free kits to residents. I attended the CHA annual meeting last month as well, which is great to see folks collaborate and get some training in from Department of Ag and DPH on food and wells and things like that. And then that's pretty much it for that aspect. Old business, we're still um, getting acclimated with OpenGov. There's things that we're just updating and working through as they come up, or if a resident has issues with some of the online formatting, we try to just fix it as it comes up. It's new, so there's going to be things that we need to adjust from time to time. And then new business. So this is the most important thing, so I kind of wanted to get to it quickly. So if you look at the first page in the budget, obviously, if you notice, the salaries did not change, but they are expected to. Um, I did not reflect it because I do need to speak to finance to ensure that I'm accurate with those numbers, with the union contracts, which were just approved, in mid-November. So the sanitary and health program planner one will have an increase, I believe, somewhere in the range of 67,000 to 71,000. The admin assistant will also be increased, to at least 45,663. And then, so I estimate that will be a little bit more than 191 that it's showing there. We might be around more like 198 to 199,000. So, that would be the biggest change. And also the chief sanitarian union contractually should have at least a 3% increase. And that's not reflected there because I need to ensure that, I get that accurate. Because this template is provided to us from the town. And then the only other highlight I should mention is if you look down in the section for health consultant fees, I have added in there a $3,500 amount. And that is because in the spring of 27, our annual assessment for the CHA, our community health assessment that we do with Bridgeport Hospital and Yale, will be due. So that is the estimated cost from Yale for that. So I wanted to make sure I got that in there. And everything else is pretty much going to stay the same as last year. The health vehicle fuel comes to me from Department of Public Works based on our usage and the current fuel rate. So that's what that number is. I'm estimating our total expenditures will be around 346,971. So a little bit different than what was reported by the town, the 328,747, which will be discussed, and that's likely what range we'll be in for our expenditures. Revenue, based on current numbers with facilities that we license, and have currently, I would assume or hope we're going to be around 83,000 for revenue. I would imagine we might be more than that. That's a conservative estimate. If you're looking at the fourth page, it kind of breaks down the licenses, the temporary food permits, salons, well permits, everything in there. You could see if there's any questions, please let me know. But based on the trends and the current numbers, this should be around where we are at with those. And then in the narrative part, if you want to take a look at the statistics from 25, so these are numbers compiled from OpenGov and what is reported by staff for the work they've done. Just to look at the food service, there was 241 inspections done, cosmetology inspections 62, 60 for soil testing, septic system inspections 151, 22 lake samples, and 25 vaccines, or 48 vaccines, excuse me, in 2025. And we're already at 75 for this year, so that's great. Anyway, so those are some of the highlights there. Does anybody have any questions about the numbers that are reported in there or anything they want to discuss further about those?
No, as you and I discussed kind of before Mike and Mary Beth came on, I would certainly um, prefer to use conservative estimates rather than kind of over-promising and under-delivering. I would certainly rather under-promise and over-deliver
Yeah.
when it comes to the end. Um,
Mm-hmm.
just as I had said earlier, living in this town for as many years as I have, I just know the way the budget system works. So
Right.
if you feel fairly comfortable with these estimates, then I would be as well.
Yeah.
Just kind of looking at some of the numbers, everything seems to kind of jive with what I can remember from years past and
Hmm.
looking down the line with, modest increases here and there and kind of holding the line on some of the other stuff certainly seems very reasonable to me.
Hmm. Yeah, I mean, I looked all the way back into 2019 at some of the, um, the expenditure categories to see like where we were and where we've come, and we're really pretty much in line all those years within, I mean, at the most, I think there was maybe $1,000 different, but there was like extenuating circumstances, like, a vehicle broke or something and they had to buy a new one. But other than
Hmm.
that, we're pretty much staying the same. And I don't have any proposals for capital projects this year. There's nothing that I expect that we're going to be spending any big money on. So, I mean, I think it's pretty status quo, other than ensuring that the union contract increases are reflected in this budget to ensure everybody gets paid properly.
Yeah, I mean the last page of the Excel spreadsheet stuff that you had sent out, with all the different years of, going back all the way to 17, 18, 19, 20,
Hmm.
and so on and so forth. Looking at the averages and then the median and then what we project for this year versus what you're proposing. Again, everything seems pretty much in line to me. Yeah, and a couple of them have gone up a little bit, some of them gone down a little bit,
Yeah.
but it all
Hmm.
seems, uh, you know, pretty much right on the money.
Hmm.
Again, if you're comfortable with what you've proposed in there, because
Yes.
obviously the total dollar amount of revenue, you're proposing, like a $700 overall increase for the whole year with what we're projecting this year.
Which is
Uh,
which is conservative, because
yeah,
I think
and
even last year we had projected 82, and I think we're probably 87 or 88 actually for the year,
yeah,
for the last fiscal year. So I'm pretty comfortable with the numbers. I just, like I said, I'm sorry that it's not totally reflected properly in the salary section, but um, there's definitely going to be increases of at least 3% for those
uh-huh.
categories.
All right. Do you have any questions about anything, Mary Beth?
No, it looked pretty straightforward to me. I appreciate the clarification around the differences, but seemed fine.
Michael, anything from you, sir?
No, I agree with what you said. I like the conservative approach. But it seems like the numbers are adding up. Good. So,
Okay. All right, then at this time, we're going to go ahead and vote on it. We will put obviously the caveat in that whatever the contractual obligations are per, the board of, per the finance department and HR and so forth, whatever those numbers turn out to be, we obviously will agree with those as well. But what you have proposed as a budget certainly seems reasonable to me. So I certainly motion to accept said budget as written, pending obviously those couple of potential changes.
Hmm. Yes.
And I can second that.
I'll,
Excellent, thank you.
I will third it.
Okay, and Miss Laurel,
I will fourth it.
seeing as though you wrote it, I would hope so.
Yes.
Okay, great. All right, so that motion carries unanimously. Um, Let's see. All right. So I guess the next thing we need to kind of talk about is just the meeting schedule. Um, Everything is going to remain the same. We will meet the second Wednesday of every month at 6, just like we have been, with the one exception in November of next year, because Veterans Day falls on our day,
Hmm.
Wednesday.
Hmm.
So we're going to move it to Thursday. Unfortunately, this year I couldn't do it because I was away, but normally the two most important meetings that we have really are the November and December ones.
Right.
Mhm.
Again, for budgetary reasons, to make sure that we're all on the same page and we have everything straight. So that's why I kind of elected to have them move that date rather than just skip the meeting. Anybody have any issues or anything with any of the dates? Obviously going that far in advance, it's kind of hard to, but everybody's still okay with the Wednesdays at this point.
Yeah,
Okay,
Yeah,
then
Wednesdays are
all right, good. I will go ahead and motion to accept all those days for the upcoming calendar year of 2026 and the first of 2027 proposed meeting dates.
she needs to second that.
Please, thank you.
I will
Mike,
second it.
okay, Michael,
third.
thank you. Great. That carries unanimous as well. So we can go ahead and file that with the clerk's office.
Okay.
Excellent.
You're just gonna sign it and send it back to us, right, Chris?
Yes.
Okay.
Yeah, which is, and that's something new as well. I never
Okay.
had to do that before last
Yeah,
year.
I don't, yeah. Okay.
Yeah, no, I'll print it and I don't know if I'll scan it back in and send it to you or whatever.
Okay.
I'll get it to
Yeah,
you
no problem.
somehow.
Great.
Okay, so what else do we need to talk about?
I just wanted to quickly mention, I know we haven't met, but Kelsey did leave. She left right on Halloween, was her last day. She went to New Canaan Health Department. Um, so we posted for her position about 2 weeks ago. We've had a few applicants coming in. So hopefully we can have an interview at some point. If not, we're gonna have to repost and try to maybe get creative. The market for public health people in that um, area is very limited, so we'll see what we can do because we need to fill that spot.
Okay,
Yeah.
agreed.
But I'll keep you updated as you want to be about that. But yeah, so we've been going on without her since the end of October.
Mm, that's hard.
But luckily it's been quiet because of the holidays and things. It hasn't been
Don't
as
jinx
crazy.
yourself.
Yeah,
Blah,
so
blah, 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 blah.
Yeah, right. Don't jinx yourself. Come on.
yeah.
Are you, do you still have somebody else doing
Samantha
inspections as
is
well, right?
still here. Yep.
Okay.
Samantha's here, so she can assist with a lot of inspections and things, but really the community health aspect,
Mm-hmm.
and the programs that we have, I'm trying to take that on right now, which is fine because some of them are still in a development phase, which is great. So I can get to see that and try to, increase residents' participation.
Mm-hmm.
But ideally, having someone else available to help with those programs and do community events, and help Jill with the vaccine program and, do some inspections and
Mm-hmm.
reviews. So we'll see what we get.
Okay.
Yeah. But that's it.
Excellent. Any questions about anything, Miss Mary Beth?
I don't have any questions. Nope.
Excellent. Mike,
Good.
anything on your end, my friend?
Nope, I'm good.
Okay. All right, great. Thank you, everybody, for your time this evening. We'll motion to adjourn our meeting tonight.
I second that motion.
Excellent.
Third.
All right. So we are officially adjourned.